Good afternoon, good evening, and possibly good morning to all of you, and welcome to an important event today focusing on the challenges of vaccination against COVID-19, looking at ethical imperatives and local realities through a lens of religion. The effort today, which is a part of a series, is to link the very broad issues that are in the headlines every day at the global level with lived experience, our lived experience, and the experience of the communities where we as participants are living, especially in the United States. And we are focusing very much on the roles of religious communities, beliefs, and institutions, which in our view has critical importance in this global crisis. In many ways, it is inconceivable that without the engagement of religious communities, we will find a solution to this crisis. We have three remarkable people who are actively, intricately involved in these issues, who will be reflecting on lessons they are drawing from the experience and will also be trying to look ahead. So I had said this is part of a series. It's actually part of several series. The Berkeley Center, the World Faiths Development Dialogue, and the Joint Learning Initiative almost a year ago launched an effort to track what was happening with religious communities in the COVID crisis. And we have extensive materials, have sent out a lot of notes, have held events. The most recent was on December 18th, focusing on the vaccine issue. And a summary of that is on the Berkeley Center website, as is a wealth of other materials. And there is another event also focusing on vaccination planned for March 15th. And we have recently put out a sort of guide to religious and non-religious communities in thinking about religious roles for vaccination. Another very important link and part of the partnership that is behind this event is the G20 Interfaith Forum, which has been going since 2014 and which is specifically focused sharply on the COVID pandemic as a global crisis management organization. So the G20 Interfaith Association will be meeting in Bologna, Italy. So another partner is the Italian partner there. And it will have many areas of focus. People, planet, and prosperity are the main themes, and healing as the underlying linking topic. And so that will all be happening in September, but with many discussions, many areas of analysis leading up to it. I'm going to very briefly comment on the classic housekeeping issues. This event is being recorded, and the recording will be available on the Berkeley Center website as well as on the G20 Interfaith website. So I can already answer one of the questions that's come into the Q&A box, which I encourage you to use to raise questions. We have an hour and a quarter today, and probably shortly before 5, we will stop the conversation among ourselves, if I can stop my colleagues, which may be difficult, and we will then be in trying to respond to the questions from outside. We will be putting out a written summary of the event because we know that the insights are of critical importance, and as well as the recording. So let me very briefly introduce my colleagues. You have bios on the website, and they will also make clear why it is that they're participating in this event. First, Sharon Eubank is the director of the Latter-day Saints Charities, which is the main humanitarian organization that's very active in many parts of the world. And she also has an interesting role as the first counselor in the General Presidency of the Relief Society, which is the church's organization for its 6 million female members. She is based in Salt Lake City and has a very wide experience in different parts of the world. Mohammed El-Sanusi is the executive director of the Network of Religious and Traditional Peacemakers. And that is a global network of which I'm also a member that builds bridges between grassroots peacemakers and global players. And the focus is clearly sustainable peace. He used to be the director of interfaith and government relations for the Islamic Society of North America. So he has very global connections, but also very local. And finally, my colleague at the Berkeley Center and at Georgetown, Jerry McGlone, who's part of the Jesuit community. And he is a psychologist with extensive experience, publications, etc. And he is both living in the Jesuit community, so he can tell us at a very local Georgetown level what's happening. But I also am hoping that he will comment on the mental health, the stresses that we all know all too well are part of the crisis. So very briefly, the questions that we're looking at. We all know, I think, that we have, in some senses, lived a miracle with the development of a vaccine in record time. It's a miracle of science and of partnership, cooperation. But it also presents some very unique challenges that have never been seen before, that the entire population is to be vaccinated. And the sword of Damocles is that unless all segments of society are okay, the danger of COVID-19 will persist. So these challenges present a host of ethical and practical issues. The first one that is called by the head of the World Health Organization a moral catastrophe is the imbalance between wealthy countries, which have already had access to the vaccine, notably the United States, but other countries as well, while until recently, 130 poorer countries had no vaccines, no vaccination in progress, and the prospect that it will take a long time for it to reach them. The moral obligation is to ensure that the most vulnerable communities, people who suffer the most, are the ones who would be vaccinated first. And clearly, there are many pressures to the contrary. So enough said on that, but that is a challenge that we will be discussing locally, but also internationally for a long time. The second is that we're facing a huge logistic challenge to try to manufacture, to test, to deliver vaccines, to make sure that they go to the right people, to track any kinds of side effects, etc. And in some places that means a ceasefire to stop war. It requires extraordinary cooperation among sectors in order to have the delivery, the actual practical delivery. And we're living many of those issues in our own community in Washington, D.C. And then the third sets of issues are persuading people that this is the right thing to do, where the trust that people have in religious leaders is a critical factor, but also to deal with the remarkably high levels of resistance and hesitation, which are linked to history, to fears, to the inadequacies of health delivery systems, and to deliberate misinformation, which spreads extraordinarily quickly, and which is dramatic as a cause of concern. So those are the issues that we're dealing with. They're ethical, they involve religious communities. They also address the issues of discrimination. In other words, the fact that the COVID crisis has unveiled and made sharper and accelerated many of the problems that we face. So with that, I will turn to Sharon Eubank. I've asked each person to be fairly brief and to address both the local particularly, but also the global. And I may challenge them or even interrupt them if they go on for too long, because I know that each one of us could talk for half an hour on the topic. But let's just start. Sharon, how do you see the situation from where you're sitting, with the Utah, but with LDS Charities, you're also at the same time looking at the world. So how do you see these two strands?
I'm so thankful that the Berkeley Center and the Brigham Young University Center for Religion and Dialogue have sponsored this. I'm very happy to share the time with Mohammed and Father Jerry. This is such an important topic, and who knew, I've spent a lot of my career dealing with immunizations and vaccines, but who knew that we would live this, a global pandemic? And so it's been very interesting to wrestle with those ethical dilemmas that you brought up so sharply, Catherine. I appreciate that. As you said, Latter-day Saint Charities is the humanitarian organization of the Church of Jesus Christ of Latter-day Saints. It has 17 international regional offices and probably about 33,000 local congregations. But for us, this has become very local. For me, living in Salt Lake City, and for any of my faith compatriots living in their communities, we're all dealing with something at the same time. And yet the local response has turned out to be very, very different. We're talking about micro local responses as the way to make something impactful. So I just wanted to make 3 points, and I'm happy to expand on these as we have a discussion back and forth. But the first one is the power of trusted faith leaders. We know for a long time that it is through the trusted voices of faith leaders that people can change their resistance to these things. But one of the new things that has happened, I think, in this discussion is the blending of science, as you mentioned, Catherine, the incredible speed with which this vaccine was developed, which usually takes 8 to 15 years, in less than a year to have this be able to roll out. And for faith communities to acknowledge that their faith in God and their trust in this scientific miracle are compatible and they work together. And I've been very moved by His Holiness the Pope, who has overleapt some of the difficult barriers about the way that stem cells might be used in a vaccine. He received the vaccine, the Pope Emeritus received the vaccine, they've given those examples, and then they have given theological resonance for, because this is so important to your health and the health of other people and the health of the globe, we feel that this is spiritually acceptable. And I hope maybe Father Jerry will talk more about that. But to see different faith leaders, the president and leader of my church, Russell M. Nelson, is a cardiac surgeon. And he posted a video online at Easter time that said, "I'm a man of science and I'm a man of faith." And those things blend in this worldwide pandemic. And I think that's been useful to people in the modern society to say we're all people of science and faith to various degrees. And we want to be able to blend those things in our response. So I bring that up. I might just give an example of that. It comes from the HIV pandemic, which is another pandemic that we've lived through, just had a slower burn. But there was a lot of resistance to testing and treatment in lots of different places. And the former Health and Human Services Secretary, Michael Levitt, told me the story this morning. He said he was tasked with working with the Ethiopian communities. There was a high rate of infection and not a lot of response. And he approached the patriarch of the Ethiopian Orthodox Church. And he asked him, is there a way to blend your belief in holy water with the testing and treatment that is required to combat HIV? And he thought about it for a long time. And then the patriarch started teaching that it is compatible to believe in holy water, which was their tradition, and also be tested so that we blend our science and our faith together. And it turned the tide in Ethiopia. He was personally responsible for the response there in HIV. And I think there's a lot of lessons to be learned in some of these examples that we're seeing of how to blend our faith and our science in these. So I offer that just mostly an observation, but it was my first point. The second point I wanted to bring up was that we need to think of education and awareness for these difficult to reach communities. What has played out in the United States will now play out in the world between rich countries and poor countries. And so we've just lived this, and not really successfully, in the United States. We have not done the best job that we could in reaching out in prisons, in immigrant communities, in places where people have reluctance, and sometimes understandable reluctance to those. I'm personally well acquainted with what has happened on the Native American nations and how their leadership has struggled. They've been so affected and struggled to be able to receive the supplies, the food, and then the vaccines that they need. So we're playing this out, and it'll continue to play out across the world. I can probably share later on some very helpful examples that the Navajo Nation has used particularly, but I think there are groups around the country who have successfully had strategies, and we can learn from some of those. I'm happy to talk more about those. The final thing that I wanted to talk about is the resistance sometimes to vaccines. And it isn't just irrational. There are legitimate reasons why people have resistance. And I'm interested in the mechanisms that empower local councils to make decisions that make sense for where they're working. This is not a religious example, but you read in the newspaper about people who had been giving vaccines, and they got stopped on a road that was closed because of a storm and an accident. And they had all this vaccine in the car with the ambulance that was going to age and not be usable in an hour. And they thought, what can we ethically do, responsibly do, so that this doesn't waste? And they made the local decision to vaccinate all the other people who wanted to in the cars on the road. Nobody in their headquarters probably thought that, that was going to happen that day, but they were empowered enough to make a local decision. There are other examples where people didn't feel empowered. There were steep fines, if they vaccinated people outside of the strict guidelines, and the vaccine wasted. So the empowering local people to make decisions that make sense for them, I think, is also critical. I'm very eager to hear some of the other comments, but I offer those in the very beginning.
Thank you. Those are very critical points. We are constantly dealing with what we think is somewhere between a misunderstanding and a myth, that there is a gulf, a genuine deep gulf between science and faith. And yet the vast majority of people are very much part of it. On the other hand, the levels of resistance are quite startling. I think the figures today were within the military, the resistance among people in the American military. So there's a lot of work to do, and we need the kinds of experience you're talking about. Let me turn now to Mohammed El-Senussi, who has a fascinating story to tell of something that I think was very unexpected, but that's happened, but that's built also on some important prior coalitions and efforts in the United States.
That is correct, Professor Marshall, and thank you so much. I really appreciate the invitation, Dr. Marshall, and of course to your staff here at the Berkeley Center. I am humbled to be part of this esteemed panel here, but I want to really begin to acknowledge that around the world today, equitable distribution and vaccine acceptance is the vital component to respond and recover from this health crisis. As a result, a whole of society approach comprising of new and innovative mechanisms is essential to achieve these challenges. So religious leaders across the United States quickly recognized the opportunity to leverage interfaith and interreligious collaboration to address these critical issues impacting every community across the country. As we know, the virus does not discriminate based on race, religion, gender, sexuality, or socio-economic status. Then the idea of interfaith collaboration to leverage vaccine distribution and trust building is derived from previous interfaith collaboration, both nationally and globally, as you just mentioned, Professor Marshall. So I have been, as you know, collaborating with the interfaith communities for over 2 decades and have personally witnessed the positive impact of interfaith collaboration to conduct successful community-based initiatives, especially in times of crisis. So as faith communities are often well positioned to respond to crisis, we thought this was a critical time to mobilize interfaith collaboration across the nation to support equitable vaccine distribution. So then I start reaching out to my interfaith friends, and I began by giving a call to Reverend Jim Wallace and several other faith leaders and faith-based institutions. As a result, we have invited national religious leaders comprising of, but not limited to, representative from National Council of Churches, the Islamic Medical Association, Union for Reform Judaism, National African American Clergy Network, National Latino Evangelical Coalition, and National Associations of Evangelicals, and Catholic Charities, just to name a few, to participate in a roundtable discussion to develop a concept note. Based on this, and Professor Marshall, you were also attended the roundtable a couple of weeks ago. So based on these roundtable discussions and several consultations, the Faith with an S for Vaccines initiative was formed in order to address 4 key objectives. The first objective here is to increase vaccine trust and acceptance among religious and minority communities. As we know, faith leaders have a key role to play in encouraging trust and acceptance in the vaccine, particularly among communities who have a history of mistreatment by the national healthcare system. So faith leaders play a critical role to foster acceptance for vaccine. I would like to clearly note also here that faith leaders must include women, youth of faith, who have their own networks and expertise in advocacy and outreach. Second objectives is to identify and utilize our houses of worship as a new and innovative venue of vaccine distribution. We know that we have the mega vaccination sites like Stadium, we have the CVS and Walgreens, but this might not be sufficient. So only relying on those sites will leave communities behind. Therefore, utilizing local and trusted sites, such as a house of worship, will encourage individuals to receive the vaccination through making the experience more convenient and comfortable. Second, a number of, or third here objective is to advocate and advance equitable vaccine distribution, notably among marginalized and minority communities. So it has been expressed by multiple religious leaders that members of marginalized communities will not be willing to travel to mega vaccination sites and would prefer to see a central community-based location used as a vaccination site. Fourth, to amplify the interreligious collaboration for service to support the common good within the United States. As clearly identified as an interreligious approach carries a high added values to support vaccination goal, an interreligious approach will also serve as an opportunity for community reconciliation in time of national polarity and division. So while here in the United States, and we are moving forward with its vaccination efforts, we must recognize that we are one of the fortunate few nations to do so. In addressing the United Nations Security Council on Equitable Access to COVID-19 vaccine, the UN Secretary General Guterres stated, and I quote, only 10 countries had administered 75% of all COVID-19 vaccines. Meanwhile, more than 130 countries have not received a single dose. Those affected by conflict and insecurity are at particular risk of being left behind. So when I asked one of my colleagues in Kenya about their vaccination efforts, he directly stated that the idea of vaccines in Kenya is a luxury. So, as Dr. Marshall has been rightly saying all along, since the onset of the pandemic, and I quote, "We are not safe until we are all safe," end of quote. Therefore, our intention is to have the vaccines for the Faith for Vaccines initiative serves as a model for other nations to build an interfaith coalition who can support vaccine distribution and combat hesitancy. It is wonderful to see that our colleagues in Finland and Kenya are looking to use our work as a model and adjust to fit their local context. So, to conclude, as I mentioned earlier, responding and recovering from the pandemic is a whole of society approach. As already seen, we have already seen in history, interreligious actors play a vital role in addressing crisis, and this pandemic is no different. The Faith for Vaccines initiative is quickly gaining momentum with new tactics to meet our four key objectives. We will soon be launching our website and social media platform. I invite all of you to follow this journey or even look to have your faith institutions participate. I would like to also to close by again, Dr. Marshall reminder, we are not all safe until we are all safe. Thank you so much.
Thank you so much, Mohammed. And I think this initiative is very exciting, but already there are, I think the underlying theme that we are addressing in this crisis is that many of the issues are very local and even very personal, but they are also very national and very global. So the idea that you have to have the local involvement at the community level and the understanding of who's vulnerable within a community at the same time that we need the White House and we need the G20 and we need the United Nations and WHO involved. So with
And
that,
maybe Professor Marshall, just to jump on this and answer a question about the administration, if you want. The White House.
Okay, very quickly.
Yes, the White House is aware of the initiative, and they will be at the roundtable tomorrow. So we're trying to partner with the government as well to integrate houses of worship in their national strategy in terms of vaccine distribution. Thank you.
That's exciting. But in the Washington area, again, this local issue is very clear because each of the jurisdictions, not only the states, but local jurisdictions have different approaches, even different criteria for eligibility. So it really is both very, very local and very, very national. So Father Jerry, bring us back to the local, but also use your extraordinary expertise to help us to think about some of these psychological aspects of what's happening. Why are people so afraid? What can we do about it?
Well, thank you, Catherine, and thank you, Sharon and Mohammed, for your wise words. I am just so struck by the enormity of the task, and yet, Catherine, your vision of really, drilling down to the local is so key. But if we could do just a quick roundup of psychologically what's going on and what are we seeing, and then come back to the local, I think would be helpful. There's overwhelming data that there are very serious psychological issues that are confronting individuals at this time of the pandemic. Obviously, the most important is what we had witnessed yesterday in the sense of, is there not an ethical imperative to grieve? Is there not an ethical imperative to really deal with our losses every day? And that's why the wisdom of just having a moment where we light a candle, where we remember those we've lost, I think it's so profoundly important, not only in our spiritual traditions, but most especially for our spiritual and psychological health and well-being. And so I'm struck by the new administration's emphasis on that. And we are going to have to remember is that beautiful word. And I think in every faith tradition, that's the core of how we begin to enter this experience again and again with sanctity and with a sense of safety. And that's the other key point I want to look at is, the image that comes to me is, the most vulnerable are going to be affected the most, as we see now in the early data of the vulnerable populations here in the United States and globally, that women and children are suffering the most. And we need to have that at the forefront of our thinking globally and locally. That unless we have, that's why I loved your insistence, Mohammed, that that faith leaders who are women need to be part and parcel of this response. I'm reminded of the AIDS epidemic yet again, and how in the United States there was a huge problem with compliance of the medication, and yet in Africa, in certain parts of Africa, they were having extraordinary higher rates of compliance with taking the medication, which is the essence of healing. Well, why was that so different? Because they involved the family and they involved everyone invested in this person's well-being. Could that not be our model for addressing your issue, Mohammed, and sharing what you were saying in regards to the common good? Is that not what we need to be looking for in the appeal to who we are and what we are as faith leaders? I think one of the key aspects of that is then therefore asking the question, if you have an existing culture of safety and safeguarding, as research that's near and dear to me in protecting children and women, then it makes sense that this then becomes the broader issue of safety and safeguarding, doesn't it? That, that how do we create that culture of accountability and that culture of responsibility? And that's, to me, what leads me into my own personal experiences of living with, just in a very short way, Catherine, to come back to the local. I live in a Jesuit house in which there are 45 other Jesuit brothers or priests. What's fascinating to me is how I've seen the COVID fear shift, so that in the beginning, it was the older people fearing the younger members of the community because they thought we were going out and we were somehow being infected, and they were more threatened. Now that we're almost a year in and half of the house that I live in are elders, and I'm still, believe it or not, below 65 by a year. But the reality is I'm not vaccinated. So the fear of the younger members of the community now is about the older members who are now, just not as mindful as we all need to be, and need, sort of reminders of how to be good guardians of safety. And is that not the ethical response we see both in my own house where I live, but in society and in the neighborhood? I want to come back to what you were saying, Sharon, that we need religious leaders modeling at every level of our religious tradition how to be advocates for vaccine distribution that's equitable and fair, and most especially how we need to be advocates for the underprivileged and those who have been traditionally targeted by absolutely outrageous histories of relationship with the medical community, to really address their fears. Answering your question, Catherine, the best psychological tool is to stay in the fear. So often we think, oh, well, no, you'll be fine, you'll be fine. And that's the unintentional dismissal of the other individual. And it's so disrespectful, as opposed to enter the fear and enter where they are. And the most effective vaccination processes are really that, where they listen to individuals, they attend to the fears, and they model a different response. So bravo to Cardinal Gregory, for example, African-American, cardinal here, who he himself has, first of all, grieved nationally the other day with Jake Tapper on CNN, and prayed nationally over the loss, modeling exactly the point. Secondarily, modeling taking the vaccine, and thirdly, going right into those most vulnerable communities that need advocacy and that ethically have to be our first concern. The rich will always get it first. And I know in the gospel Christian tradition, the first shall be last and the last shall be first. There are so many parables I want to use right now in regards to the fact that we have got to get a handle on the underprivileged and those countries being excluded, as the president of Mexico said yesterday, that this is an ethical global dilemma that finds expression right in the neighborhoods of DC and right in this house that I live in.
Yeah, that's exactly the point that I think we can learn so much from. And you also have the irony, frankly, that many people are frantic to get vaccinated, to the point they're willing to charter a plane and go somewhere else. And yet the people who need it most either can't have access to it. Location seems to be very important, but also are those who are most afraid and frankly most burned by the failures of our health system. So you have this bizarre irony playing out right before us, and certainly in our own community. Well, I must say I have dozens of questions for all of you, but there also are lots of questions coming in. But let's do one more quick round at least. Sharon, you were at least tantalizing, giving us some sense of the positive lessons that are coming from the Navajo community, which I think would be quite fascinating to know a little bit more about. And then for any of you, and we can go through all three, I think getting a better sense of how to address these fears. What is it that seems to work in people who have a bad experience, whether it's Tuskegee or being given a bad medication or being ignored by the doctor or whatever? How do we rebuild that trust? So Sharon, let's start with you.
I appreciate that you brought up Tuskegee. I was talking to a healthcare professional in the Black community. He said, of course, Tuskegee is the example and there are others. But he said most people, in his view, don't have real, legit, serious worries about something like Tuskegee happening again. Their bigger fear, although there is that distrust, their bigger fear is that they will not be treated with dignity and respect. And so it's the easier mental gymnastics to just say, then I don't want that. And that was interesting to me that he brought that up. I say that in preface to this beautiful case study that has happened in the Cherokee Nation and the Navajo Nation. They traditionally have quite low acceptance rates. They have their own healthcare systems, and many, many people believe in traditional medicine and only traditional medicine. And the figure that I read was 75% of people in the Navajo Nation are willing and ready to have the vaccine, and they're rolling that out. That 75% is much higher than the United States acceptance rate. We saw, you mentioned the military rates, and I wondered, how did they do that? So I started making some phone calls and visits, and I have been impressed by what they did. The Cherokee Nation made a very interesting decision. They have 2,000 fluent Cherokee speakers. They are a cultural treasure and heritage. 45 of them have already passed away from COVID. So they were very culturally aware, and they put their 2,000 Cherokee speaking fluent elders first in line. And what that did was make the cultural tie. This is so important to us to preserve our cultural heritage that we believe in the vaccine and trust it enough that we will vaccinate these 2,000 elders. And because they did that, the acceptance rate along the Cherokee Nation was very, very high. The Navajo Nation did something very similar. Their medicine men were the first wave of the inoculation, and they got to decide that locally because they may or may not have been in the age group. But once they did that, and tribal and religious leaders began to answer questions over the radio, and they hold these town meetings twice a week, and they used Navajo doctors to work with people speaking Navajo to answer all of their questions about the vaccine. The Medicine Men's Association certified the vaccine. Traditional farmer cooperatives were working with all of their members. All of those things contributed to the 75% acceptance rate. And I think there's real lessons to be learned from that. As we talk about the global need to procure the vaccine, it will be the local need to accept the vaccine. And I think that's a good example.
Yeah. Fantastic. Mohammed, I'm going to ask you what is frankly in my mind, the toughest question, which is that you've brought the interfaith leaders together, you and your colleagues, and you've identified what the challenges are. How do you move from that to practical action? Because we all know that's where the challenge is.
Right, right. Yeah, no, so practical actions, so we're trying to be the faith leaders to be a trusted messengers. So we wanted basically to demonstrate when you're having the vaccine administered in a house of worship, that is clearly giving a positive message to the community. We want faith leaders to be the first. Some of them already being vaccinated publicly and sharing those videos and all of that. We have to figure out kind of a holistic strategy how to basically comfort people to address misinformation hesitancy as well. We are talking about how we can record national faith leaders and athletes and prominent people to do that. We also talk about how we can also bring people that they were hesitant to taking it and they were somehow convinced and took it. They can testify as well.
Mhm.
So all of these ideas actually are forming practically to do that. So that's why we hope, and the good news here is Catherine, is the business community is also coming. This morning we got a call from someone. He said that he will remove all logistical issues for houses of worship if they wanted to administer vaccine, just realizing that how important that it is. So we're making progress and we have to continue working on it.
Great. Father Jerry, I love that you brought in and put so much emphasis on the women and children, which really, the vulnerable of the vulnerable. I was on a call this morning where people were highlighting the suicide rates among young people, teenagers, which is the worst sign that you can imagine of despair. What practical steps would you suggest to Mohammed, for example, and Sharon, who are both at the pinnacle of some very large and important networks, or for us looking at the G20, what should we be telling the G20 leaders?
Well, there is no, I don't see the human person in separate compartments. That when we talk about spiritual health and spiritual comfort and common good, I see that as intricately connected to the mental and physical welfare. That's why the issue, I think, for me, of gender rights and really utilizing, like Mohammed, what you were saying, when you have women in the community who are having had the vaccine and having taken it and bore witness to a certain extent of
Right.
that behavior. You can't duplicate that witness and that power of essentially what I would call relational, sorry to be a Jesuit at this point, that relational ontology. But my colleague David Hollenbach talked about how the common good is always about relationships, is always about building and fostering those relationships. But to be most specific about this, I think we have to understand that we've never seen something as urgent as this need, that the rates of suicide are off the scale. I mean, so many reports, even globally, in Japan, where the rates of female suicides are off the scale. What we see in Bangladesh in your work, Catherine, and what we're seeing in various other countries, that we have to be sophisticated enough to understand that this tsunami is just beginning. That what has been hidden in the pandemic is going to be coming at us in absolute unbelievable numbers. Let's predict that. And with the more predictability, there's control. And I think that's why, it's so important that we have resources, that we gather resources now, that are mental health experts in those faith traditions, and not just think that it's the experts who need to be there, but actual members of the faith community who can also talk to the fears and talk to the mental health issues, who can then refer, hopefully, to professionals. But this is what I call the pandemic within the pandemic. And we are just at the beginning of hearing that the waves and seeing that the water is going out, and anticipating that we're going to see an enormous flood of mental health issues that the world has not seen before. So
Catherine, can I comment on what Father Jerry just said? Because I think that's so important. Every indicator about the virus globally is saying it's not just about the virus and the vaccine. It is intertwined with this mental health tsunami and also a food crisis. And those two things at the very basic needs of being human and surviving are intertwined around this virus. And the comment are, we'll never go back to the way it was before. This has completely shifted the underpinnings of a global society, and we must be nimble enough to react to that. That's why I'm so glad what Mohammed is doing. Faiths for Vaccine, the grassroots structure of that will be able to tackle some of these other issues as well.
Well, we have a lot of questions, and we won't probably be able to address all of them, but I promise you we'll look at them and we'll work on having them guide us as we move forward with the project. But let's shift. We clearly, and there are some questions that are relating to some of the issues we've been touching on, which is the vulnerable groups in the United States, whether they're ethnic or whether they are location or whether they even are political or religious. In other words, people who are seeing they're religious. But we also have something, Mohammed and I particularly are working primarily on the issues of the poorest countries in the world and the ethical imperatives to look for equity and equality in a meaningful way. So we have the situation now where we in the United States, we're all sitting in the United States, are acutely conscious that the vaccine campaign is moving very quickly here, even with the prospect of seeing us get to the levels where the resistance is the real issue rather than the delivery. But many countries do not. For vaccine is still a theoretical issue, and they may not even believe in COVID. Much less in the need for a universal vaccination campaign. So how do you, let's start with Mohammed on that and then ask Sharon, what would be a way to take what you're learning? I guess that's the most constructive approach, is not to go back. We can't go backwards. We can't change history or what's happening now, but we can look forward. So how do you see the next steps of having this be a more global effort? You might even mention the project that we're both working on in South Asia, which is dealing with communication.
Exactly right. Yeah, thank you so much. I think that's very important. And I always say that when we have a model here in the United States, it's completely different context. And we are not taking the model and imposing the model in other countries. We are sharing our experiences.
Heaven forbid.
Yes, we are sharing our experiences, and if experience is fitting that context and could be customized and used, we welcome that. So practically speaking, there is no way we can do this without, collaboration and interreligious collaboration in particular, to address this issue and the whole of society approach that I mentioned earlier. We do have an experience before in the polio vaccine, and we had to involve religious actors from Afghanistan, Nigeria, and Pakistan. These are the three countries still they have polio. So Bill Gates supported religious actors to have a conference in Senegal. I was involved in my previous capacity at the Islamic Society of North America, to gather scholars to talk about this and to issue fatwa, religious opinion, to say that vaccine is okay. So therefore, in our global vaccine trust and distribution strategy, we need to integrate, in our strategy, the voices of religious actors and the local custom and cultures is quite important. So right now, as you mentioned, Professor Marshall, in collaboration with the Berkeley Center, we are working in Southeast Asia to address issues of misinformation through raising awareness, in Southeast Asia, particularly in Pakistan, India, and Bangladesh. It's a media campaign, and these are issues as a result of COVID, of the pandemic. We want to address those issues. So collaboration is going very well. So that's why we have to take this globally when vaccine is available to reach out to those in fragility context. They cannot. And that's why when I talked to my colleagues in Finland last week, and they were so fascinated about the initiative, and they're thinking now to have a Europe-wide interfaith roundtable to address vaccine equity.
Yeah. Sharon, I know that early in the crisis, you were talking about the kinds of extraordinary efforts I think that people were making to produce masks and so forth. But within your networks, what are you hearing as to the major challenges, but also the major opportunities through the LDS charities?
In a global pandemic, I think efficiencies of scale are particularly important. And so, as Mohammed mentioned, the large global procurers, UNICEF, Gavi, World Health Organization, they have not only experience, but they have distribution channels. And ethically, they are bound to work with the most vulnerable first. Now, that doesn't always practically happen, but I think we can, as stakeholders, help to hold them accountable for those things. We need their efficiencies of scale. It doesn't do much good to have lots of people trying to figure out distribution chains for vaccine. But at the same time, they need the networks, the grassroots networks of the faith-based organizations. And I appreciate the example of the fatwa and ways that we can work together on those. We are two hands of the same body, and this is a real opportunity. We have worked together on maternal newborn tetanus and polio and measles in the past, but this is, this will overcome all of those things. As Father Jerry said, it's a tsunami. And we have the opportunity to activate people who haven't been active before. And I'm, of course, because I'm a counselor in the Relief Society, we're very thinking about what can women do, not only because of their strong networks, but if this will give them an opportunity to have expertise and voice in their communities that they may or may not have always exercised in the past. And there's a tremendous opportunity to activate youth who care about these issues, who are eager to learn about all sides of the equation and have the energy to go forward and do that. And I've seen some very interesting examples of youth being really driving their communities, their faiths, their local councils and things like that. So I think those are where the opportunities lie.
One of the perennial issues in the interfaith movement that I'm actually going to throw to Father Jerry is, and it came in one of the many excellent questions, that the issue is that numerous local and regional religious institutions spread the right message and counter the misinformation, but they still remain in the shadow because the media likes the negative. So those who deny science or those who do any other to do the negative things, so they speak more loudly. So is there a way to that more little groups who are loudly opposing vaccination and who receive the predominant media attention can be countered? And I think that it is the broader issue of social media and the viral spread of information, but it is also this tendency to look to excitement or to drama rather than to the steady, gritty kinds of work that so many organizations are doing, and the positive role and the spirit, the hope that they have. And what you see in the headline is something much less so.
Well, I think, Catherine, you hit exactly on the topic at hand that we're seeing not only nationally, but globally, and has local implications. You look at what we've just been through in these past couple of months here in the United States. It's a perfect example of the one with the loudest, bullhorn gets all the attention. I think mainstream faith traditions can unite over this. And I think, Mohammed, your point of that this interfaith, collaboration is fundamental. The more it can be seen, the more it can be known, the more that then the local pastors or the local rabbis or the local, shamans are able to then, take that common voice and make it very practical for their particular synagogues or temples or parish or faith communities. I think that's where in hierarchical institutions, the power of the bishop or the power of the pope, and the local example of what we've seen with the Archbishop Gregory again, is absolutely fundamental to that rollout. And also then in the parish communities, how they can do that. I think what also has been very comforting is to see the major organizations like the USCCB, the United States Catholic Conference of Bishops, put out papers, and you can go to their website right now and see the real challenge about the disinformation and how being vaccinated, when you have the Congregation for the Doctrine of the Faith in Rome also commenting on how this is still important for us to be vaccinated, even with all the concerns about the cell lines that may or may not be involved in each of the various vaccination possibilities. But the other key thing that's heartening too is then seeing Christianity Today, a whole chart about that reality. And so those Christians who, like myself, are very pro-life also have a chance to look at this in a rational way and then view it intellectually. But that means that we communicate that equally with those who keep getting the noise, coming back to your point in your question. If we don't speak as loudly as they do, then our voices and the sanity will be dominated by the insanity.
Mm-hmm. Sharon, you focused a lot on the issue of trust, which I think we all know is very fundamental. We have a crisis nationally, but also globally, I think, of erosion of trust in most institutions. And I think there's an erosion of trust in religious leaders, but it's still much stronger than others. There's one question which you might weave into an answer with or expanding on your thoughts on this trust issue, which is the undocumented population in the United States and the particular fears that people have, which may be interlinked. In other words, their fear of being deported or their fear of losing whatever they have. That means, in a very practical sense, that they may be reluctant to be vaccinated, but it also highlights the complexity of that issue.
I'm glad that you brought this up. Myself personally, I worry most about the people who are separated from their natural community for whatever reason. I think about people in prison. I think about people who have are living in the undocumented society that they just don't have, for lots of reasons, they don't have a community of trust. I think about the children that are maybe citizens, but their parents aren't. But in lots of ways, they're separated from their natural community, and so I'm afraid that this will swirl around them and never really touch them. And I saw one of the questions that was on the chat, and I think it's important to this too. What's the relationship between free will and trust? Because as governments around the world have varying degrees of compelling people around the vaccine or around requirements and different things, there's a cost to that. And every time we compel people to respond in a certain way, trust goes down. And so we have to be aware of that as we make these decisions as society. And that's the flip side of what you asked about, of how do we increase trust with these groups who don't maybe naturally trust. I think giving them as much self-determination as possible in the realm where they are is critical. And I think faith communities to not forget their most vulnerable people who are a little bit physically separated from their sources of faith and trust. And then working as citizens in where we live to somehow balance the needs that we have to protect everybody and the protection of people's abilities to choose, and work with persuasion and long suffering as the scriptures teach us. And it takes longer, but the effects are more powerful in the end.
Mohammed, when we started a year ago thinking about this, there were some things that we could predict from history. And one of them is that during these kinds of times of a pandemic and uncertainty and pain, you see a rise in discrimination, and you see a rise in scapegoating of certain communities, and even conflict. And you are a peacemaker. So how do you see the links between some of the specific issues we're talking about of misinformation, erosion of trust, and the questions that I would lump under fragility, the places that are, for example, in Eastern DRC, where the Italian ambassador was killed, but so many other situations which may or may not be related to COVID. But I think this accentuation, and I think also digging in of people's prejudices that are fueled by fear. What is the best way to deal with that?
Yeah, thank you so much, Professor Marshall. This is a critical question, but before I answer that, probably I want to also add to the question of the undocumented, communities, and I feel there is a responsibility on all of us to communicate the right message to those who are vulnerable, undocumented, or to actually remove that fear from them. It is a responsibility of the federal government, it's a responsibility of local governments, and it's a responsibility for us as the faith communities and society as a whole to have clear messages. This is the time that we need everybody to be vaccinated, and come and get the vaccine without any fear of anything else. So I think that message has to be clear. But coming back to the vulnerable people who are living in fragility context, it is from our own experience that working with local communities and people that they know better than everyone else, their local context is quite critical in understanding that. So I always say that, I have been working, as you know, Professor Marshall, in Central African Republic with religious actors and leaders, but we did not do much in engaging traditional leaders and people that just believe in customs and traditions and other kinds of beliefs. So these people need to be engaged somehow. So in the fragility context, we have to be careful when we go there, giving those who knows the context to lead us, how they can bring indigenous mechanisms in addressing crisis issues. They do have their own mechanisms. We need to talk to them and have them to lead these indigenous mechanisms, and making sure that we are not basically disturbing their own culture and system that they have. All of these things will definitely help in having them increasing the trust among themselves and the trust of people who are coming to help them, and that will reflect positively in vaccine distributions or anything else.
I may add to that, Catherine.
I also wanted to throw to you, as you add to that, the problem of social cohesion and how you see some of these issues tying into that critical, in a sense, missing link in our contemporary society. So on to you.
Well, exactly. When we have loneliness rates that are at a pandemic level, when we see the fabric of society diminished and our relationships fractured, and especially now in COVID, I think it becomes even more imperative, to back up what Mohammed, you were saying, to reach out much more concretely and utilize all of the features of society and of various religious traditions to our benefit and to the benefit of the common good. I think one of the key aspects I want to go back to that was mentioned is, for me, living in community here, one of the best sources of consolation that eased my fears over receiving the vaccine was talking to those who had received it and what were the side effects. And with every person, there's a different story. And I think those stories need to be told. And these are the witnesses in faith communities that need to be tapped, that they can talk to the younger ones, they can talk to those on the fringe, they can talk to those who are undocumented. That's why it's so important to really go back to the refugees, the migrants, and have individuals in those cohorts and in those populations experience, you know, the vaccine firsthand, because as you know, in those areas, rumor and innuendo and threats are spread, you know, like wildfires. And so the more you can spread the wildfire of wellness and protection, that's equally as powerful. You know, the old adage that anger is much a contagion as hope, you know, and fear as much as a contagion as hope and healing. And I think, to me, that's the momentum this, you know, can have, much like you started with, Catherine, the sense of we're at a miraculous time. Let's not let the vagaries and horrible tragedies that we see determine the full extent of our response.
We're coming to the end of this fascinating discussion. So I'm going to turn to each of you to highlight or to emphasize any of the issues that you think we should either look ahead on, in other words, that we should be moving in the future, both personally, but also as nations and as a community, and anything you might have forgotten. So let's start with Sharon.
It's the natural question when we listen to a webinar like this, or when we read things in the news, is to just think about, what can I do? What is it possible that I myself can do in my limited circle? But I have been moved today about the discussion of economies of scale. And while that's true for the big global organizations, it's true for each one of us. We have networks and we have religious communities where we belong, but we are not always good to link those networks and communities together. And this Faiths for Vaccine is a very interesting idea of people who have not been together before. Let's get to know each other. Let's join together so that we can have that economy of scale with people who have good desires, have lots of different approaches, and we can learn from each other. So I take that away and I share it as a challenge for anybody listening. Whatever your network is, make some bridges and connections to others so that we can grow those concentric circles and be more powerful.
Yeah. Mohammed.
Yeah, thank you so much. Fascinating discussion here. And I just want to reiterate what Sharon has said here. This is going to take all of us to address this issue, regardless of any orientation. That's why we created this Faith for Vaccine as an initiative, and I hope everybody is welcome. Any denominations, any religious group, are welcome. And non-religious, anyone could bring, added value to this table. They're most welcome. It could be replicated to other places as well. I think that's very important. It is a collective effort that we need to do together. And then we should not forget those who are vulnerable, those who are in fragility context, as you were saying, Professor Marshall, earlier. We need to address that as well as we move forward. We need to advocate on behalf of these people. We need to take this discussion to all kind of levels through multilateral discussion in United Nations and other places, and the G20 summit that is coming up soon. So I think all of this effort, it has to be. And then finally, the issue of involving women of faith and youth is quite critical. They are populations today. We cannot reach them unless we are involving youth and women. And that's quite critical as we move forward. So I just want to emphasize that point.
Father Jerry.
Oh gosh! First of all, Sharon and Mohammed, you've taken the wind out of my sails here to a certain extent. Just wonderful points. Again, I want to come back to the mental health issues and how important the local scene really is. That we can't possibly solve this if we just think of the global tragedy amongst us, but psychologically, we know change occurs when we break down what we can do into small chunks. So for example, one small chunk I would recommend to decrease loneliness in youth and in ourselves is to monitor our media use so that it is about connecting to someone else rather than lurking on the media or commenting on the media. That one of the key aspects of research is to how you decrease levels of loneliness and isolation in the young, in the middle-aged, and in faith communities, is to use that as a source of prayer, to use that as a source of connection, to use that as a source of ways in which, you know, it builds up the community and therefore witnesses to healthy vaccine distribution and healthy vaccine implementation in multiple local ways. And I want to re-echo the point you were making, Mohammed, that women and children are going to be most adversely affected by this, and especially those in refugee or migrant ways. We have got to get resources ready and able and on the ground in order to address this enormous inequality that's happening both in vaccinations, but also in the ways in which we value women and we value children. And to me, when we do that, then we will be working for the common good.
Well, the common good is clearly what we're after. And early in the crisis, and I think we've heard it reiterated at many stages, is that sometimes a crisis can bring out the best in humanity. The better angels come out when people recognize that they are facing common issues. They can see the humanity, the stories of others. But we also know, as I was highlighting before, that crises can bring out the worst in humanity. That when people are afraid, they may become a mob, which we saw all too recently. And I think we are struggling with perhaps the greatest moral challenge that we've ever faced, with our eyes open, but also with a situation that's shifting. I sometimes think that the metaphor of a storm is especially appropriate because it strikes in different places in different ways. So it seems to come and go. So a society will think, like New Zealand, that they've solved the problem, but then it comes roaring back. And that's the uncertainty, I think, and the continuing common challenge, as well as this clear fact that we need to remind ourselves of constantly, that we are in this together, even though we're in very, very different boats, but we are in it together. And until we solve it together, we will not be able to move to look not to normal life, because I think, Sharon, you're right, things have changed. Things will never be quite the same, but to a better world. So I thank you, all three of you. You've been absolutely remarkable. We're going to capture what was said here because I think that it's very special. It is a continuing discussion, and we'll count on all of you to be part of the continuing discussion. We thank everyone for remarkable questions, which we will pass on and look at, each one of them. And we'll count on you also, those of you who are watching and listening, to help us in thinking through to the next stage. So we will be sending out a note to everyone who registered of where to find the recording in a few days, and we'll be working. You've put us to work in trying to bring this all together. So thank you so much, and good evening or good morning or good afternoon.